Good afternoon, everyone, and welcome to today's briefing on
Bonjour à
New Brunswick. Bonjour tout le monde et bienvenue.
Welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honorable Dorothy Shepherd, Minister of Health.
Today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous. Good afternoon, everyone. Le Nouveau-Brunswick a réussi une certaine...
New Brunswick has experienced some success in controlling the spread of the COVID-19 virus in the year since the pandemic began. Our successes are due in no small measure to our efforts to control passage across our borders.
Experienced some success in controlling the spread of COVID-19 this year since the pandemic began. Our successes are due in no small measure to our efforts to control passage across our borders. Over the past year, New Brunswick has maintained strict rules for people coming in and out of the province for work and leisure. Travelers have been required to self-isolate upon arrival and be tested for the virus during their self-isolation. The majority of the nearly 1,500 COVID-19 cases we have seen over the past year can be traced back to infections that occurred outside of New Brunswick. Without these controls on travel, we would have seen many more infections, sickness, hospitalizations, and deaths due to COVID-19. But now, as our case numbers continue to fall and our vaccination effort accelerates, we can consider a gradual loosening of some of these travel restrictions. Le Conseil des Premiers Ministres de la...
The Council of Atlantic Premiers has announced the reopening of the regional travel bubble that was in effect from July to November of 2020. Minister Shepherd will talk about this in a little bit, but I can tell you that Public Health supports this initiative.
The opening of the regional travel bubble that was in effect from July to November of 2020. And Minister Shepherd will speak to this shortly, but I can say that Public Health is supportive of this move. Our respective provinces have epidemiology teams that have been meeting on this subject. And so in the coming days, and Minister Shepherd will provide more details on that. In the coming days, we will begin vaccinating New Brunswickers who travel in and out of the province for work, truck drivers, rotational workers, and cross-border commuters. And Minister Shepherd will provide details on that as well. COVID-19 is still with us and with our neighbors to the south and west. The prevalence of new variants, which are more easily transmissible and spread more quickly, is of great concern. À ce jour, on dénombre 15 cas confirmés du variant de la COVID-19 qui a été identifié la première fois au Royaume.
10 cases of the new variants are still active, and they are variants from the UK. As travel restrictions ease, the risk of new infections could increase.
First identified in the United Kingdom, and 10 of these cases are still active. As travel restrictions ease, the risk of new infections and outbreaks from these new variants may increase. And that's why everyone needs to remain vigilant and follow public health advice and guidance so that we can continue to move forward toward a new normal in the months ahead. Aujourd'hui, Santé publique.
Today, Public Health is reporting 7 new confirmed cases of COVID-19 in New Brunswick. In Zone 4, which is Edmundston, Grand Falls, and St. Quentin, there are 5 new cases. There is also a new case in Zone 1, which is Moncton and southeastern New Brunswick, and 1 new case in Zone 3, which is Fredericton and the St. John River Valley. These new cases are travel-related or contacts of existing cases, and all are currently self-isolating.
New confirmed cases of COVID-19 in New Brunswick. In Zone 4, which is Edmundston, Grand Falls, and St. Quentin, there are 5 new cases. There is also a new case in Zone 1, which is the Moncton and southeastern New Brunswick area, and 1 new case in Zone 3, which is the Fredericton and St. John River Valley. These new cases are travel-related or contacts of existing cases, and all are currently self-isolating. There are now 48 active cases of COVID-19 in the province, including one person in hospital. And just to come back to the variants of concern, in particular the UK variant, which we saw in the Zone 7 cases recently, we did a really great job in terms of public health being able to get that under control and do some really rapid contact tracing, contacts of contacts, and testing and isolation. So that is happening right now in Zone 4 as we see new cases happening because of the variant, and we will continue that same approach. Please continue to keep all New Brunswickers who have been affected by COVID-19 in your thoughts and prayers, especially the ones that are in the hospital or in ICU or have passed away. All of these families need all the support that we can give them. Les nouveaux variants de COVID-19.
The new variants of COVID-19 are rapidly becoming the prevalent strain across Canada, and there is a worrying trend of rising infection rates, particularly among those aged 20 to 50. The combination of a highly infectious strain coming into contact with those most wary of the pandemic is driving up infection rates and hospitalizations across Western Canada.
Rapidly becoming the prevalent strain across Canada. And by that, I can give you the example of Saskatchewan, where they started off with very low numbers of the variant. They're now at 90% of the cases in Saskatchewan are the variant. It is a worrying trend of rising infections, particularly among those aged 20 to 50. The combination of a highly infectious strain coming into contact with those most weary of the pandemic is driving up infection rates and hospitalizations across Western Canada. And as tired as we all are of COVID-19, it is absolutely vital that everyone, young and old alike, remain vigilant and continue to take precautions to prevent the spread of the virus. If we let our guard down, we may see our hospitals and ICU facilities overwhelmed with new cases from these variants, as is now happening in Alberta and Saskatchewan. And as I said earlier, travel restrictions have really been the key to our success in terms of how we have done with COVID-19 prior to the variant arriving, but it's also continuing to be very effective with the variant in terms of trying to keep it out, but we still have to remain vigilant when we do have cases of the variant right now. We have had fewer cases of people importing the virus than many other jurisdictions, and our self-isolation and testing requirements have enabled us to catch COVID-19 infections in many travelers before the virus could spread more widely. But the risks are still there, and I do ask that all New Brunswickers who have symptoms get tested immediately. That is the only way that we can stay ahead of these cases. Depuis 3 mois et demi, 111 personnes ont reçu un résultat positif à un test de dépistage de la COVID-19 à leur retour.
Over the last 3.5 months, there have been 111 individuals who have tested positive for COVID-19 after arriving in New Brunswick from out-of-province travel. Public Health has determined that these cases led to at least 58 secondary infections and possibly more.
There have been 111 individuals who have tested positive for COVID-19 after arriving in New Brunswick from out-of-province travel. Public Health has determined that these cases led to at least 58 secondary infections and possibly more. Some infections may have eluded our contact tracing efforts. Of those 112 travelers who tested positive, 37 had traveled for leisure purposes, 22 were international students or temporary foreign workers, 16 were truck drivers, 15 were rotational workers, and 7 were daily commuters across the border. 13 were for other reasons, such as caring for a sick relative or attending a funeral, relocating the province, or for non-essential travel for work. We are providing these statistics not to blame or shame anyone. No one sets out to catch or spread the virus, but to illustrate that the efforts that we have made and continue to make to limit the spread of COVID-19 in our province. Bien que certaines restrictions sur les déplacements seront assouplies au cours des prochains.
Although some travel rules will be eased in the weeks ahead, we will maintain strict testing and self-isolation rules for many travelers to New Brunswick.
Some travel rules will be eased in the weeks ahead. We will maintain strict testing and self-isolation rules for many travelers to New Brunswick. Eventually, travel restrictions between our region and the rest of Canada will be relaxed, but we are not there yet. We need to continue to protect our people and our vaccination campaign so that we can build up a higher level of immunity in our population before we are able to take that step. And really and truly across the country, it is something that all provinces are doing to get one dose of the vaccine on board, all their population, by the end of June. And if we can do it sooner, if we get more doses, that is exactly what we will do. So COVID-19 will be with us for a while, and there will be more infections and more outbreaks. We all have a role to play in limiting its impact while our vaccination effort is underway. That means continuing to wear a mask in indoor public spaces. It means maintaining 2 meters of physical distance between yourselves and others whenever possible. It means washing your hands regularly and thoroughly and maintaining good hygiene practices. And it means staying home when you feel unwell and getting a COVID test if symptoms emerge. It is so very important to get tested. I think the fewer number of cases we have in the province, I think we always see the test numbers go down because people feel that they don't want to get tested, or they don't have time, or it's inconvenient, or they don't think that they should be concerned that their symptoms are COVID-19. But that is the opposite is very true. So please always get tested if you have symptoms, because that is what's going to continue to protect us. And these are the actions that have protected us thus far. So we have been able to avoid the calamity that other jurisdictions have seen and are seeing currently. And I feel very fortunate and very grateful that we live in New Brunswick and that we have had such great success at keeping our population safe. But we are not out of the woods yet. We do have a ways to go. And so we are moving into the next phase of our pandemic journey, and we must continue to work together to keep each other safe. Au fur et à mesure que nous progressons vers la phase.
As we move into the next phase of our pandemic journey, we must continue to work together to keep one another safe. And keep being patient and compassionate.
Passionate and kind and patient. Merci beaucoup. Thank you very much.
Good afternoon. Bonjour. As you know, Premier Higgs met last night with the other Atlantic premiers. They have decided that beginning April 19th, travel will be permitted between New Brunswick, Nova Scotia, Prince Edward Island, and Newfoundland and Labrador without the need to self-isolate. This is conditional on COVID-19 numbers remaining low. Beginning April 19th, residents from the Quebec regions of Temiscouata, Avignon, and Listoquet First Nation will also be permitted to travel to New Brunswick without needing to self-isolate starting in April, under the conditions that they have not traveled outside of those regions in the past 14 days, or that they have received the first dose of vaccine and are at least 14 days past that. I know these are exciting developments, but our ability to move forward hinges on our progress over the next few weeks. If we see major outbreaks, we will be forced to delay openings of these travel bubbles. As travel restrictions are loosened and we continue to roll out our vaccination plan, we will prioritize those who must travel for work, including truck drivers, rotational workers, and cross-border commuters. As we have mentioned last week, our intention is to ensure people in these groups have the opportunity to receive their first dose of the vaccine by the end of this month. For now, I can tell you that as of March 26th at 11:59 p.m., neither rotational workers nor their families will need to self-isolate if they have received their first dose of the vaccine and 14 days have passed. For the time being, they will have to undergo testing on day 5 and on day 10 each time they return to New Brunswick. This will provide us with an extra layer of security without requiring them to self-isolate. If a rotational worker chooses not to be vaccinated, they must continue to self-isolate for 14 days, along with anyone else living in the same household. Unvaccinated rotational workers will also be subjected to mandatory 10-day testing. This will allow us to track the virus, as every traveler who enters New Brunswick comes with a level of risk. We will have more details very soon about when rotational workers, as well as truck drivers and cross-border commuters, will be eligible to be vaccinated in New Brunswick. I am pleased to tell you that we are making excellent progress on our vaccination plan. As of yesterday, all residents of New Brunswick's long-term care facilities have had the opportunity to receive at least one dose of the vaccine. To date, More than 11,600 long-term care residents have received a vaccine. This is excellent news. It means we have made great strides towards protecting our most vulnerable population. Tomorrow, we are on track to complete clinics in First Nations communities where the first dose of the vaccine will have been made available to all residents aged 16 and over. Just yesterday, pharmacists across the province began administering vaccines to residents aged 85 and over. And I'm also pleased to announce that beginning today, people age 80 and over may contact a pharmacy to set up an appointment to receive their first dose. A family member or caretaker can also call on behalf of someone in that age group. As mentioned last week, some pharmacies have an online booking system, and we recommend using that service if it's available and if you are comfortable navigating it. If not, people who are 80 and over and those calling on their behalf can call a pharmacy directly to schedule an appointment. If you are under the age of 80 and you are not calling on behalf of someone in that age group, please continue to be patient and do not contact a pharmacy at this time. We want to avoid overwhelming pharmacies with unnecessary calls as much as possible. Beginning today, people with a complex medical condition are also eligible to book a vaccine appointment. Vaccines will be administered to this priority group through clinics organized by Horizon Health Network and Vitalite Health Network. Appointments for people with a complex medical condition may now be booked online by visiting the website gnb.ca/bookavaccine. Before you book your appointment, please review the list of select medical conditions which can be found by visiting gnb.ca/coronavirus and clicking on vaccines. If you are eligible based on your medical diagnosis, please print the declaration form, which is also available on the website, and bring it to your appointment. If you do not have access to the internet, please call 1-833-437-1424 for assistance. If you do not have a printer, copies of the form will be available when you arrive for your appointment. At this time, online appointments can only be booked by those who are eligible due to their complex medical conditions. Regional Health Authority clinics are also beginning to vaccinate regulated allied health professionals such as dentists, physiotherapists, optometrists, and others. These are healthcare professionals who have close contact with patients. These individuals will be notified by their professional association when they are eligible to book an appointment. After a long year of living with COVID-19, a brighter future is only a few weeks away. We have made it this far through the pandemic by following the guidelines in place and doing our part to protect ourselves and everyone around us. Thanks to the increased supply of vaccine, we will soon be able to live less restrictive lives. For now, please continue to wear a mask indoors. Maintain at least 2 meters of physical distance from others and get tested if you have any symptoms. If we fail to follow the rules now, we risk delaying the opening of travel bubbles and the loosening of other restrictions. This isn't a risk we want to take. Let's all keep up the good work and slow the spread, giving more New Brunswickers the opportunity to receive the vaccine so we can all return to a more normal life. Thank you. Merci.
Merci beaucoup, Ms. Shepherd et Dr. Russell. Thank you, Minister Shepherd and Dr. Russell.
We will now proceed with the reporters' questions. You can ask your questions in the language of your choice. You each have one question. Please mute your microphones.
Questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Tim Roselle, Global News.
Thank you, Bruce, and good afternoon. I know this is a COVID-19 update, but I'm wondering if Dr. Russell could address the news of this mysterious neurological syndrome that has circulated over the last 24 hours or so, the news that has come out about that?
Sure. So we've been monitoring the situation ourselves here at Public Health, along at the national level with the surveillance at the national level for Creutzfeldt-Jakob-like disease syndrome. So what we have right now is 43 cases. We have 35 confirmed and 8 suspect cases. And what we know is that based on the diagnostic tests of all these people, they have symptoms that are like Creutzfeldt-Jakob disease, but they don't actually have the diagnostic lab confirmed prion that we would look for. So because of that, it's unknown etiology. So it has the same symptoms, but it is not of that etiology, but it looks like it. And across the country, based on the surveillance, we're not seeing this anywhere else. So since 2015, we've been working. Once we saw that there was an increased number of cases, which would have been identified by the local physicians, neurologists in the Moncton and northeastern part of the province. That's when we did ask at the national level, you know, are we seeing anything like this in the rest of the country? So now we're in the phase of making people aware, making sure that that physicians in the province, in that particular community, are watching for neurological symptoms like this, and they can refer their patients to neurologists to be assessed. And so that's what's happening now. There is a lot of like questionnaires in terms of trying to link commonalities and causalities there, which we don't have finished right now, so that's underway. The unfortunate part is that it is affecting some younger people, and so it is something that we're looking into right now and collecting as much information as we can.
Thank you, Doctor. Thank you, Mr. Roselle. Jean-Philippe Hughes.
Oui, bonjour. Ma question est...
Hello, my question is for Dr. Russell. Yesterday, Blaine Higgs opened about a complete opening of the borders of New Brunswick with the rest of Canada for about July. He said it depended on the level of vaccination, a certain level of vaccination being reached. Do you think this is doable? This is hard to tell. This is the process that we will use to make decisions. For the Atlantic bubble, we will use the same mechanism to open the borders to the rest of Canada.
It's an ever-evolving situation that we have here, and as new information comes forward, you know, right now we know that there are a few provinces that are really struggling right now, and their case numbers are going up. So for now, we'll focus on the Atlantic provinces. And with our Atlantic province premiers, and we'll go from there.
Thank you. Merci beaucoup. Laura Brown, CTV.
Hi there. I'm also going to ask a question about, I guess, the rare neurological disease that's cropped up, I guess. I'm wondering if are you ruling out CJD, or could this be a variant of CJD, or is this possibly a new disease altogether?
So it most likely is a new disease. We haven't seen this anywhere else, and so it is of unknown etiology, but the symptoms are very much like CJD disease. So yeah.
Thank you. Harry Forstall, CBC.
Thank you, Bruce. Dr. Russell, how significant a public health threat would you describe this as? And given that its causes may be environmental, what is your advice to the New Brunswick public?
Well, right now it's just about awareness for again, the healthcare providers to watch for those neurological symptoms and for the public to watch for them. We have a lot of work ahead of us in terms of trying to determine the cause, so it's too early really to say very much more than that.
Michel Corriveau, Radio-Canada.
Oui, bonjour. Question pour Dr. Russell. Alors,
I have a question for Dr. Russell. In Zone 4, in École Notre-Dame, is it the variant? We just confirmed that the cases that we identified in Zone 4 here in New Brunswick, the lab identified that it is probably the variant. I believe that the way we will be approaching the cases that we see will continually be as cases considered as being the variant at this time. And what about the school Notre-Dame? I do not have any information on this case, but every time we have a case about an outbreak in Zone 4, we will be considering that it is the UK variant.
Oh, hi there. There's a lot of news here, but I'd like to ask about the prioritization of high school staff and students who are old enough to receive a COVID-19 vaccine. Are those populations currently prioritized to become vaccinated at any level? And where do they fit in, and when will they see their vaccines? Thank you.
So our last update came, we reverted back to age cohorts in a declining fashion. And so at this time, discussions are still undergoing about schools.
Thank you, Mr. Bateman. Vicky Hogarth, CHCO.
Thank you. My question is either for Dr. Russell or Minister Shepherd. There have been new long-term care residents who've moved into nursing homes in the past few weeks who missed out on the vaccination clinics. What's the process going to be for them to be vaccinated, and are the homes or the families responsible for reaching out?
Vicky, you're going to have to speak a bit louder, please. Can you repeat it, please?
Sure. There have been new long-term care residents who moved into nursing homes in the past few weeks who missed out on vaccination clinics. What is the process going to be to vaccinate new residents, and will the homes and the families be responsible for reaching out?
I'll take it.
So thanks for that question, Vicki. At this time, I'm going to have to defer that to our task force team to see how that's going to be monitored. I know that with other demographics, for like with our First Nations, we had some who missed those first clinics, and we're making arrangements for those that to happen. And so I can't imagine that we wouldn't make arrangements to do the same thing with long-term care residents. We will figure that out. It really will break down to the vaccine, the distribution part of it, right? So we'd have to time it well.
Thank you. David Caron, Acadie Nouvelle.
Oui, pour Dr. Russell.
David Caron, Acadie Nouvelle. We are opening the bubble to Témiscouata and other regions. I was wondering what kind of control measures are in place to make sure that the people on the Quebec side have not traveled, or that they will respect the bubble.
I will answer that one. So we've been in discussions, with I've certainly spoken to the Minister of Health in Quebec about the regards to opening up. It's very important to these communities that they have the support of our New Brunswick communities. They are fairly isolated from the bigger portion of Quebec. So what we'll be doing is certainly, as we did before, relying on the citizens of this area to not travel out of their zone into other areas of Quebec, certainly within 14 days of coming into New Brunswick. It will be monitored. It will essentially be an honor system. It has worked before, and I'm sure it can work again.
Thank you. Danielle Edwards, Canadian Press.
Hi, yes, this question is for Dr. Russell. You'd mentioned earlier that this mysterious disease that looks like Creutzfeldt-Jakob has been affecting young people. I just wanted to know if you could elaborate on that. How young is young? Do we happen to know the age of the youngest person who's been affected?
I do have those ages. I just don't think I have them in front of me. Can I get back to you with that? Can I get back to you with that information? Because I know we do have it.
Thank you. Thank you, Danielle. Meg Cunningham, CHMA.
Thank you, Bruce. My question is either for Dr. Russell or for Minister Shepherd. April is still a month away. Should an outbreak occur in the Atlantic provinces during the conference, will that date automatically get pushed back, or do the provinces have the opportunity to end April?
Meg, we couldn't hear a single word. Can you get a little closer to the microphone?
How is that?
Better. Fire away.
Sorry about that.
No worries.
My question is either for Dr. Russell or Minister Shepherd. April is still a month away in terms of the Atlantic bubble. Should an outbreak occur in any of the Atlantic provinces, is that date automatically pushed back, or do the provinces have the opportunity to get any outbreak under control before the opening of the bubble?
So I'll start, and then Minister Shepherd can finish answering that. So prior to the dissolution of the bubble, we actually had a mechanism to sort of monitor each province in terms of if they had outbreaks that were concerning and what type of areas they were in. So my understanding is that each province would be able to look at the data, and we'd obviously keep each other. We follow each other's data very closely, and we'll continue to do that. And so there definitely will be some triggers that would each province would feel comfortable changing the approach.
Yeah, and just to build on what Dr. Russell says, this, it's ever evolving. If there's one thing we've learned through our COVID reality and experience is that things can change very quickly. Newfoundland saw that recently, and so we have thankfully very good relationships with not only our premiers are well engaged, but Dr. Russell and her team and the epidemiologists are in constant communication. So we're really, grateful that we have that kind of communication, and our decisions can be based in pretty real time, so that we can support each other in those decisions.
Thank you. Mia Urquhart, CBC.
My question is for Minister Shepherd. I'd like to run a not-so-hypothetical scenario past you. A man who grew up in New Brunswick and now lives in Quebec would like to visit his father, who lives in New Brunswick and has dementia, but his father doesn't recognize him. He wants to visit him before his father doesn't recognize him anymore. He wouldn't qualify for an end-of-life visit, but in many ways, this is exactly what the visit would be, a final goodbye. Is there any way this man can visit his father under the current rules?
As of today, I'm not thinking that there's a clear path here. We have a process for that application, and as we progress through this, I cannot say how heartbreaking COVID has made lives for many, many people, and we don't want to have these kind of situations. But we have a COVID reality that we are all living with, and so that's why the process is in place. So I can only encourage that he follow the process and make the applications, and I'm sure that as soon as we can make a positive answer, we will.
Thank you. Allison Sampson, CTV.
Good afternoon. I'm wondering, how steady will the supply of vaccines be to ensure that appointments at pharmacies go as scheduled?
So we've gained a lot of confidence over the last probably 3 weeks plus in the numbers of vaccines that we will be receiving. We know, I'm sorry, I don't have the numbers right in front of me, but we've already administered almost 76,000 doses. We're going to be we're going to be receiving consistent levels, I believe, close in the 20,000 per week over the next several weeks. And the clinics are planned. And as you know, we've got 218 pharmacists on board. So right now, we have a very high level of confidence in the supply that we are receiving and will receive.
Thank you. Thank you, Minister. Thank you, Ms. Sampson. Savannah Odd.
Hi there, my question's for Dr. Russell. Zone 4, of course, saw a pretty significant death toll in long-term care homes this year, and in general in the province or long-term care homes. So I'm wondering, as we open up and possibly see more cases, have those affected homes in these outbreaks this year been inspected or reviewed? And if so, were public health rules sufficient? Were they not being followed, or are there gaps in the rules? And if there are gaps, have you made any new recommendations to keep residents safe?
Tell you that we are definitely following up with all of our nursing homes and long-term care facilities to ensure that proper protocols are in place. You know, there was probably some learning curves as things went on and the proper use of PPE, but as a whole, we're settling in, you know, to a fairly routine maintenance of all of those precautions. I do think that when this is all over, we are going to, or when we all have our vaccinations, I think we're going to have to take a step back and assess everything that has gone on through COVID, and to ensure that we are prepared for the next pandemic, no matter how far out it would be. And I think that is prudent to do in any kind of situation as we've lived through this last year.
So no new recommendations, sorry, just to clarify, and maybe that would be a question for Dr. Russell, but no new recommendations in long-term care settings?
Well, I don't think we can nail down anything today. I think that ongoing at every single indication that we may have a transmission of COVID-19 in a long-term care facility, or at the time of having it, there have always been full assessments. And actually, yes, the prompt team may make suggestions to management and staff of any facility at any time. But it's been done in real time at this point. I think for an overall, we'll have to wait until we kind of get to the bulk of the other side of this pandemic to begin assessing what maybe long-term recommendations may come out of this.
Thank you. Maud Montembeau, Radio Canada.
Oui, bonjour, j'aimerais.
Hello, I would like to come back to the question asked by my colleague from Acadie Nouvelle. So what are you going to do to make sure that the Quebec residents from Témiscouata, can you give us a better idea of how it will work? There will be a control, a checkpoint, but will you ask for a proof of residence or proof of vaccination? If someone comes from Montreal, could very well say that they got their vaccine and go through this route.
I can take that. You know, as we have gained a lot of experience with our border scrutiny, residents crossing into New Brunswick have had to show their identification, and postal codes were kind of the driving force behind that. You know, behind that implementation of policy. So I believe that would continue.
Marie Sutherland.
Good afternoon. My question's for Dr. Russell and is about this neurological disease cluster. The memo sent to the province's healthcare professionals was dated March 5th, but there have been cases here in the province dating back to 2015 in increasing numbers. Why was the memo sent just now, and what developments prompted this?
So because the surveillance system at the national level really captures the signal if there is something that's out of line with what we would expect with those types of symptoms in people. We've been working with our local physicians and public health and at the national level as this has evolved. And so once they decided that it did meet the criteria for a cluster and that we should be looking further into it, that's when we started that process.
Clara Pasica, Times and Transcript.
Hello, my question is for the Minister or Dr. Russell. My question is in regards to the vaccine clinics that are being organized in New Brunswick. So this is outside of the pharmacy system rollout. So your website says that clinics are being organized in New Brunswick. In response to another question recently, the Minister just said clinics are planned. But there's not a lot of information about where these clinics are. Small towns, especially in rural communities, are telling us that their community centers aren't booked, and I haven't heard anything about how the vaccine might be reaching their communities. So what is your plan for letting us know where these clinics are? We've confirmed a clinic is opening as early as 2 weeks, so why is this information not public? What's your plan for letting us know, and specifically, can you speak to rural and small municipalities?
So I'll take that. So as you know, with regards to booking with an RHA clinic, so Horizon Health Network or Vitality Health Network, those are limited to first responders, firefighters, police officers, and also to healthcare workers and health system staff, and individuals now with complex medical issues. So there is a 1-800 number and or an online registry, and at that time of registry, I believe individuals will be given their appointment and their location. So if that's any different, we'll certainly clarify that with you later today. But that information is conveyed at the time of appointment confirmation.
Thank you, Ms. Pasica. Aidan Cox, CBC.
Hi, good afternoon. This question is for Minister Shepherd. How might rules for the yellow phase here in New Brunswick change when the bubble reopens? For example, if limits aren't increased on household bubbles, will we have to bump people from those bubbles to make room for friends and family visiting from outside of New Brunswick? And is there any sort of coordination in terms of pandemic restrictions across the provinces for the new bubble?
So I'm going to let Dr. Russell answer your first part, and the second part will be, we've now set a date, so we will now have a little bit of time to define what those full parameters might be. So I can't speak to that today, and Dr. Russell's going to answer your first question.
So it's a great question, actually, because we are planning for those things exactly, again, based on challenges and risks and practicalities. So we will be providing more information about those types of details, but that's a really great question, and we are having that discussion.
Thank you. Sarah Seeley, Brunswick News.
My question is for Dr. Russell. I was just wondering what kind of response public health has gotten since the memo went out to medical professionals about that unknown neurological disorder.
I haven't personally gotten any feedback on that. Again, we do have a team of people that are working together with the Creutzfeldt-Jakob disease surveillance system at the national level and here in New Brunswick. So it's quite early. I would expect that we probably will get some feedback. And obviously people with neurological symptoms, we do want to make sure that they get seen and referred to a neurologist.
Thank you. Cela termine notre conférence.
This concludes today's update.